Good morning. Thank you for taking the time out of your day to join us. My name is Mike Blackwelder, and I'm the Chief Administrative Officer for Start of Mecklenburg County. I'm excited to welcome you here for today's event, Taming the Octopus, a live presentation and solution-centered discussion. We have a lot of great content planned for today, including updates from Smart Start staff on our strategy and some new initiatives moving forward, as well as key insights based on research and lived experience from local experts and advocates for children with special healthcare needs. We try to include a portion of the event for question and answers from the audience if time permits. Until we get to that portion, if we can ask everyone to remain muted. We are recording this session, so it's completely up to you whether or not you would like to have your video on or off. Since we have so much to cover this morning, let's go ahead and get started and dive into the content. I will turn it over to Jake House, CEO of Smart Start of Mecklenburg County.
Good morning, everybody. I'm going to wait for some slides to get going here. Great. Thank you all for being here. It is truly an honor to be with you. We have been overwhelmed and amazed by the amount of feedback, positive, that we've gotten from this report that has been published, and we're just excited to start the conversation today. I mean, over 100 people have registered and are coming in. So I don't want to be the show today. We've got great panelists and great content. But what I want to do is just take a couple of minutes to talk to you about kind of who Smart Start is, where we're going, how we got here today, and then ultimately where we go moving forward, because that's what this is all about. So if we could hit the next slide. So a lot of you on the call probably are familiar with Smart Start, but a lot of you aren't. And a lot of you may say, I think I know what they do, but I'm not entirely certain. So let me try to just, take a step back here and explain it. So Smart Start started in 1993, and it was Governor Hunt who put it in place. And the idea was to put early childhood focus and funding into every community and county throughout the state of North Carolina. And so there are 75 local Smart Starts or local partnerships that exist to do just that. And the mission being to ensure that every child is ready for kindergarten. And a lot happens between that 0 and 5 space. So here in Mecklenburg County, we are the largest of the 75 partnerships in the state. And what I and my team want to do is fulfill this mandate to lead the way for the 0 to 5 community. That's not meant to be us doing it on our own. That's not a my or our or I thing. It's a we thing. So if you think of nothing else but about Smart Start, think of it in 3 areas. So first, probably the thing that we're most known for is we fund the early childhood community, right? We put forth throughout 20 different organizations in the 0 to 5 space, ranging from health, family support, early care and education, and literacy. And then we have a couple of programs that we run in a campaign. But largely, we do our work through our partnerships and through collaboration, which leads me to the next area that we are shifting more so to trying to do this type of work in collaboration and convening. I want our organization to bring people to the table, raise our hand and say, hey, we can help to do that. If you've got an idea or if you want to put something forward, we can help to bring groups together to do that. And today, in many ways, is a perfect example of that. The amount of interest and the amount of people that have come together for something like this is exactly what we want. But we know that it just has to keep going, and that's my commitment as the leader of this organization to keep doing. The third area, which is harder to do and newer to do for us, is we want this organization to be a hub for innovation. I want to try things. I know we're going to fail. It's okay. And I know that's antithetical to how some people have thought about Smart Start in the past from a compliance-driven organization. We have not even come close to meeting the needs of all of the community, all families, all children. And I want us to try new things and not be afraid to fail. So we got going with a little bit, starting some of that earlier this year with some innovation grants. That was the first time we've ever done it. We're gonna make those a lot bigger. That's gonna continue to grow, and we're gonna do other things. That's my commitment, but I wanna do it with others. We do this through partnership. So think of us funder, collaborator, convener, and a driver of innovation. Next slide. So how did we get to this Taming the Octopus? I mean, here's a brief timeline, and it's been a minute, right? So a couple of years ago, our board sought to learn more about the system of care that was available to the population with special healthcare needs. We decided to fund a needs assessment in late 19, and then early 20, the work started going, and then boom, right? I think everybody knows what happens next. And there aren't many good things that came out of COVID, if anything. But what I would say is COVID uncovered even more issues and more opportunities for this population. So to the team's credit, we persisted, the team persisted, and we used COVID to influence the report and uncover new things. And ultimately, earlier this year, we published Taming the Octopus, which is what brought everybody here today. And that is the beginning of these community-wide conversations. And I emphasize the beginning. If we are not doing our job, if the work stops today and a report sits on the proverbial shelf, that won't happen. That's my promise to you. So let's go to the next slide. So the big thing is, what do we do now, right? And I think about this in 4 areas. So first, we have to listen. That's what we're here today for, right? We're here to listen to the people who are closest to this work and who ultimately influence the experiences of families 0 to 5 and children with special health care needs. We learn. We're going to learn from this. We're going to learn moving forward. We're going to partner. We already do that well in many cases, but there are still many, many more opportunities for our community to do this for this around this subject and for this population. And then we're going to implement. We're going to implement, and some things are going to work, some things aren't. That's okay. We're just going to keep going, and then the cycle continues. So I also want to call out kind of 3 tenets of this, and it's important because you'll read this report if you haven't already, and you're going to be like, wow, that's some pretty tough stuff. There's some tough language in there. That's all right. I mean, identifying problems and issues, it's not a finger pointing exercise. We're not doing this, or we're not showing our bruises and our scars to say anybody's doing something wrong, but what we're saying is, hey, we've got an opportunity to make something better. And the only way it gets better is if we lean in as a community and help to solve this together. And like I said, again, today's a step forward, but ultimately what we do tomorrow and the next day is going to determine our fate and our success, and really the fate and success for our families and those children with special health care needs. So this last line, you're going to hear me say this more, you're going to hear our team say this more, but all, capital A, capital L, capital L, all children should turn 5 ready to thrive, okay? So that's all I got. I want to turn it over to the folks who are here. My next slide really is just my thanks to you for being here. Thanks for leaning in. Thanks for starting this conversation. That's my email. Reach out to me anytime. I will always get back to you. I may not have your answers, but I will seek to get them and follow up. I promise you that. So again, thanks for being here. Thanks to our panel. Thanks for all of our guests. And I'll hand it back to Mike.
Great. Thank you, Jake. Really appreciate that. I have to say and agree with Jake. It is a really, really exciting time to be part of Smart Start and the next evolution of the organization. There are just so many great things going on and great things to come. So I can say, I speak for the rest of the team when I say it's just a very exciting time to be involved. The moderator of our panel discussion, Jonathan Scott, is a researcher, writer, and strategist whose clients include Smart Start, Foundation for the Carolinas, Spartanburg Regional Foundation, and the Mary Black Foundation. He is a former print journalist who lived in Charlotte for 16 years before moving to Asheville in 2004. Jonathan, I'll let you take the stage.
Thanks, Mike. So when Smart Start asked me to submit a proposal for this project, I was interested in doing it because I just finished working on a research project for the North Carolina Partnership for Children, which Jake mentioned is Smart Start's parent organization. And it was also appealing to me because a few years back, I'd done a needs assessment for children's mental health and found that one of the gaps in services is children with intellectual and developmental disability. So Taming the Octopus became a continuation of that earlier work. So when I began the research, I learned about all the services that Smart Start provides to children with special needs. For example, Guiding Parents to Services is an in-house program for parents of children with autism. And Smart Start also provides funding to Charlotte Speech and Hearing, Safe Alliance, the Early Childhood Intervention Program at Navant, the Polywalk Project at Thompson, and child care subsidies through Child Care Resources, Inc. But the thing that impressed me the most is that being the parent of a child with special needs is really, really hard. You know, it's just hard to imagine what it would be like to have a special needs child. I mean, there's a dozen different categories of disability for children under the age of 5. And many more children experience developmental delays that may be temporary and don't necessarily rise to the level of a diagnosis. And kids with special needs are not a homogeneous group. The commonality among them is they all require nurturing above and beyond what most families can provide by themselves. Simply put, they desperately need our help. So you might be wondering why today's event is called Taming the Octopus. So as I was writing the report, it occurred to me that the systems of care are like an octopus, but each tentacle of the octopus has a succession of agencies wrapping the child and the family in services. So octopi are extremely smart and they're very sensitive. They're complex creatures, as are the systems of care. But as a result, parents often become the full-time case managers for their children. So staying on top of it all is a little bit like wrestling an octopus. So I hope today's discussion will be a significant step forward as we work together to tame the octopus. And with that, I'll kick it back to Mike to introduce our panelists.
Great. Thank you so much, Jonathan. We're very grateful for your work in this report and excited to talk about it. We have an outstanding group of panelists today, and it's my pleasure to introduce them all before we start with our questions. Dr. Sloan O. Story is an assistant professor of special education and child development at the University of North Carolina, Charlotte. Her recent research interests focus primarily on the preparation of early childhood special educators. Dr. Morgan Walls is an assistant professor of pediatrics in the Division of Academic General Pediatrics at Atrium Health. In addition to clinical responsibilities in medicine, she is a trained researcher, earning her master's in health service research following pediatric residency training at Vanderbilt. Lisa Kleininger is the director of Mecklenburg County Children's Developmental Services. She has a 20-year history with the organization in various roles and has worked in early childhood spaces in Charlotte, such as summer camps, preschools, higher education teacher preparation, and young child mental health programs. Dr. James McDowell Durant currently practices at Novant Health Developmental and Behavioral Pediatrics, Eastover location. He is a graduate of the University of South Carolina School of Medicine, and he also completed a fellowship in developmental pediatrics at the University of South Carolina. Cheryl Mandel is the program manager for pre-K programs for Charlotte Mecklenburg School's Exceptional Children program. She has been with CMS since 2006, serving in various early childhood roles, including classroom teacher, coach, and coordinating teacher. Rachel Lowry is the mother of 2 children with special needs, Demaine, who is 7, and his 4-year-old sister, Abby. One of her children was born with co-occurring birth defects, and the other was diagnosed with autism at age 3. Rachel's journey as a supermom has taught her how to navigate the system of care. As healthcare and childcare professionals, we can all learn a lot from her experiences. Panelists, thank you for being here. And Jonathan, I'll let you get the discussion started.
Well, I want to thank all the panelists for being here as well. And I'd like to start with our parent, Rachel Lowry. So Rachel, when I interviewed you for the report, you told me that you had to learn by trial and error over the course of several years how to navigate the system. What's the best advice you could offer to parents who are in a similar situation as yourself?
The best advice I could give to a parent who is starting off on that journey is to utilize as many resources as you can possibly find. You know, the hospital kind of gets you started when your child's born, or the developmental pediatrician will point you in the right direction. And from there, you start to meet like a network of services and supports and things like that. And honestly, even learning from other parents has been crucial for finding resources and finding ways to get better care for my children.
Well, thank you, Rachel. Our next question is for the 2 medical doctors on the panel. So we have systems of care that can be rather disjointed. Sometimes each provider has its own case manager or care coordinator. So really the parent becomes the coordinator of all of the professional coordinators. So Dr. Walls, we'll start with you. What do you see as the key to building a stronger coordinated system of care?
Yeah, well, that's a really important question, but it's certainly a challenging thing to limit to just one answer. I will say that I think that there's two main things that are really important for building a coordinated system of care, with those being communication as well as awareness. So it's impossible to work together if community organizations, clinics, therapists, families in need are existing without knowledge of one another. And it's incredibly difficult for parents then to navigate a system in which they are unaware of what's available to them. I think about as a doctor, there's a lot of things in medicine that don't change based on location. So, for example, if I'm taking care of a patient who has asthma, it doesn't matter if I live in Charlotte or if I live in Nashville or if I live in Florida, I'll use the same medications, I'll refer to the same subspecialists. But when we think about child development, it's very different. We have to use our local resources, which might look really different from city to city or from county to county. So if you're not aware of what's available to your patients that you're serving, there's no way that you can help coordinate that care. And patients, I'm sure, might experience the same thing if they're moving with a young child to a new city. How are they to know what's available to them? So that would be the first thing, awareness. And I think this event this morning and then the Taming the Octopus report are really great steps in increasing that awareness. And then the second thing for communication, seeking ways to build our communication between parents, families, medical home, the early intervention team, the school system, other community services is vital if we really want to function together as a team. And what that might look like could be different. Some might suggest having family navigators or patient navigators that are embedded in clinical sites. That might look like having a liaison that works with different organizations. For example, in our clinic, we were able to establish a relationship with WIC and have a liaison. So if I have a patient in my office that's having difficulty with formula or with even getting signed up for WIC, it's easy for me to call my liaison and for the parent to have that number to contact them as well. And then we can sort of have that multi-directional communication. So I think that that's really important. And whatever the modality is, in order for us to address the current barriers to working together as a team, we're going to have to address the barriers to communication.
Okay, thank you, Dr. Walls. Dr. Durant, same question. What do you see as the key to building a stronger coordinated system of care?
Yeah, I'd echo a lot of what Dr. Walls said. I think communication, without a doubt, is the core when you've got multiple tentacles of the octopus, and you have to have something connecting all that. And listening to Jake talk a little bit at the start about not a lot of great came out of COVID, but one of the things that really did push healthcare forward, and I think in a lot of domains, is the ability to communicate through teleways, through Zoom, through Google, just the way we can connect a little bit easier electronically. And I think that's going to help in the future. I know, just for an example, the masks, I'm sure in the school and in their early education space, been a lot of debate, a lot of parent pushback sometimes with masks and everything. And, I found ways to work with the early education system and the school system with CMS to kind of have some meetings to talk about ways we can make things work. We all in our different specialties approach our passions through different lenses, and we each are right in our own regards in terms of how we're looking at things. My wife is a school psychologist, and we talk a lot about her requirements versus my requirements, and how do we blend some of those together. And so, as communication is core, I think approaching our passions with humility and some understanding to where we can kind of come together in terms of how we see the needs of our patients, sometimes differently, but we all have the same goals to really help them grow and succeed. So to echo Dr. Walls, the communication, but also approaching that with humility, and that we each have different strengths to bring to the discussion, and And as that comes together, we can see things from different sides and really help each other out in what we do.
Thank you, Dr. Durant. Our next question is for Lisa Cloninger. She's director of CDSA. In an ideal world, when children are getting services from different providers, the systems of care would be seamless. Families would receive all the services they need, but we know that doesn't always happen in reality. So Lisa, when you look at the ecosystem of services for birth to 5, what do you see as the biggest gap in services?
I think right now, and like lots of folks have alluded to already, COVID has exposed one of our weak spots here in Mecklenburg County. And one of the things that we continue to try to meet the needs for families and young children here is around social emotional needs and development. Families with young children birth to 5 have not very many resources available to them here in Mecklenburg County. We're such a resource-rich environment. We do such a great job of supporting families around their medical needs and developmental needs, but we don't have a lot of resources when you get right down to it for mental health services, for family therapy, and especially for evidence-based practices that we know work for families that are that young. Lots of our providers in our area are private practice. Most of them don't take children or families with kids under 3. And the agencies that we do have, and there aren't a lot of them in town, often have waiting lists for services. And so those are big challenges that we run into. And we're really fortunate in Mecklenburg County that we are one of the few CDSAs that do have good county funding. And with that funds, we've been able to build a network within our CDSA of trained early childhood mental health specialists. And so we've been able to have some resources there and to continue to work across agencies here in the county to build that up. The other big challenge is that we know that these evidence-based practices that work with children birth to 5, when we think of those like ABC, attachment biobehavioral catch-up, child-parent psychotherapy, parent-child interaction therapy, and pyramid model practices, those are the gold standard ways to serve young children and families around social emotional development. We also know that those are expensive to train. Sustainability and ability of therapists to learn those practices and use them well over time, that those are big challenges. And certainly if we're engaging people in private practice or folks who a lot of times in mental health services, those are contracted services. Folks are paid for the service they provide. They're not paid for training time and paperwork time and learning time. And those are just big challenges. So I still think we have a ways to go here around supporting those social emotional needs for families. We really dug in at the CDSA, and Smart Start has helped us have some nice conversations. And other agencies around the county, especially Z5, are really thinking about how to plant our feet and work on this as a county. But I think this is our biggest gap right now that we need to attend to.
Okay, thank you, Lisa. I mean, we know that there are a lot of gaps in services, but we also know that there are barriers to accessing those services. I want to come back to our parent on the panel, Rachel. Rachel, can you describe one of the things that stood in your way to accessing services and tell us how you were able to get around that barrier?
A lot of the barriers were time. Time was a huge issue as far as wait lists. To get diagnosis and to get services started. What she said was spot on with the funding, and insurance isn't, not everywhere accepts the same insurance. Both of my kids have the same insurance, but there's a higher wait list at the locations that accept the insurance my kids have. So that was a huge hurdle for us because early intervention is so important. But by the time they started receiving services, they were almost past that age where, the intervention was considered early.
Okay, thank you, Rachel. One of the things I learned in doing the report was that, in each of the systems of care, each agency, each institution, has its own rules and regulations that have to be followed. most often it's not the agency that makes the rules. They just have to follow them. And so that's particularly true for an institution like Charlotte Mecklenburg Schools. And Cheryl Mandel is the preschool program manager for special education at CMS. So Cheryl, what would be your number one recommendation for policymakers, either at the local level or in Raleigh?
Jonathan, I thought a lot about my 30-second elevator speech that I would give to policymakers that I ran into. And of all the topics that have ever come to mind, it's all circled back to one thing, is that we've got to remember that it's about the children. Decisions that are made, rules and regulations that are put into place, at the end of the day, it impacts our children and our families directly. So we have got to figure out a way to take those rules and regulations and make them less about a checks and getting it done and clicking the boxes, and more about really focusing on the children, the needs, the family's needs. And the only way to do that, as has been mentioned throughout this conversation, is through collaboration and communication within our community.
Mm-hmm. Mm-hmm. Oh, thank you for that. We also have Dr. Story, who is involved with special education and child development. You know, as someone who teaches the next generation of special ed teachers, what's the most difficult thing our future teachers are going to have to deal with?
It's a big question. So the first thing that I start with, and it's kind of been a theme so far in this conversation, is that we have to train our future educators to understand how to individualize and, just like Cheryl was saying, meet the needs of those individual children and families. So something I tend to always come back to is setting reasonable expectations. So we keep hearing, you know, we want those children to be ready to be successful and healthy at 5 and enter that kindergarten classroom. But children don't just appear at the age of 5 years old. They're coming with years of background experiences, both them and their families. And some of those might have been negative. You know, they're coming with many transitions from hospital to home and home to preschool. There's a lot of children that end up falling through the cracks. So when we're thinking about our early childhood special educators, they tend to be generalists. They have to know a little bit of information about a lot of different things to be prepared to enter the classroom or to be service providers. So one thing that we have to think about is it does come back to us as professors and preparing them to be ready. And just like you all are saying, that comes back to communication. We need to think about how we can be a little more interdisciplinary in their training and be more intentional about the experiences that they're getting while they are, you know, in the classroom at the university setting, so that they are well-rounded and prepared to go out into the field and be able to team and collaborate with diverse, you know, backgrounds and other service providers that are in the community, so that, again, those children and families are really receiving the supports and services that they need and that they prefer.
Mm-hmm. Okay, well, I have a follow-up question for you, Dr. Story. So based on your research, what evidence-based best practices should be followed that maybe aren't currently being put into practice in Charlotte Mecklenburg?
Well, I'll start by saying, as one of the newer people to the state of North Carolina in general, I can't possibly know for sure all of the practices that are being used. So what I come back to is, first and foremost, are the practices that are being used, are they being used as intended, right? So if we're thinking about fidelity, are they being used, you know, to the best of their ability? That's going to be really important. The other thing that we need to be thinking about, again, coming back to those children and families, evidence-based practices are not going to be very effective if we're not intentionally picking the practices to meet the needs of the children and families that we're matching them with. So again, we have to use our evidence. We have to use data to make sure that there's a link between the two. Otherwise, we're not going to see the outcomes that we're looking for those children and families anyway. We tend to see, we throw a lot of evidence-based practices at the wall and just look for what's going to stick. But we do have research and evidence to show that there are connections between what we use with the families and children that we're working with. So I think that that's going to be the biggest piece, is making that connection.
Okay, thank you. Thank you. So let's circle back to our medical doctors. Dr. Durant, how can organizations like Smart Start, CDSA, and CMS work more effectively with the medical community to make sure that we're all collaborating?
Right. Well, I think from a medical community standpoint, we need to continue to educate each other about the services that the CDSA, the CMS, and Smart Start offer. Because it's awesome. Really, these kids have these amount of resources here in Charlotte. It is incredible. It's never perfect. We always want to kind of keep improving, but yeah, the more when I talk to residents or students and talk about the whole system of early intervention, and their eyes get big and they're like, wow, that I didn't know all that was out there. And I think and that's somebody that's in the medical field that's pretty far along in their training. And so I think we have to educate each other about what's out there. In terms of how we all can work together, I think that the intersection points are really important. And so the 0 to 3, 3 to 5, and how does that transition work? And from a medical standpoint, with kids with special needs, a lot of those kids have autism, and they're receiving an autism diagnosis kind of around that time. And so how do we integrate these services with maybe some outside services like ABA providers, and how do we fit all that into an IFSP or an IEP, and to make all that kind of work together? And so I think at those inflection points, I think that's where communication is the most important from all of us to kind of figure out how we can put all those pieces together.
Well, thank you. So this next question is for our other MD on the panel. We're going to come back to Dr. Walls. Could you speak to the social determinants of health and how racial inequities create barriers to accessing services for people of color?
Sure. So when we talk about social determinants of health, we are referring to social factors that can impact health and quality of life. So those may include education, income, literacy, your access to healthy food, safe housing, exposure to violence, transportation. So if you're having difficulty in any or in one of these areas, for example, poverty, it can understandably lead to reprioritization of the other things in your life while you are trying to meet the basic needs for yourself and for your child and for your family. That can also increase what's called toxic stress, living through the stress of managing these things, which can ultimately impact the child's development and brain development in those early years. So social determinants of health are one contributor to health disparities, but there are other factors to keep in mind, like implicit bias or systemic barriers that can exacerbate inequities. So for example, if we have resources that are available in the community, but the service is only available to our English-speaking families and children, or as our parent on the panel mentioned, people with certain insurance, then that might create a barrier and widen the gap in care for vulnerable children. So racism is a social determinant of health, and we do see the impact of structural racism in our country and in our county and in our city, particularly for African Americans who have chronically been disadvantaged and disproportionately impacted by many of these social determinants of health. So that certainly contributes to the health disparities that we see in child health generally and in child development specifically. So then the challenge becomes, what do you do when the population who often is having the highest health need is also the population that historically has been disadvantaged and has the most barriers to meeting those needs due to social determinants of health. So I think it's a very complex answer and multifaceted, but I do think it's really important as we look and we think about ways to strengthen the system of care for children with special healthcare needs, that we hear from patients themselves, as it's been said already in the panel, that we think about the patient, the child, and the family, and that we really build from them inside out as opposed from outside in. And I think it's important that we consider asking families to identify what social determinants are impacting the child, their development, and then potentially their ability to access the services that we put in place. So that creates an opportunity, one, to provide assistance to families where we have resources to do so, but also places value on the fact that in order for us to improve child development, we will have to address these inequities in our society. And we've seen, even with COVID-19, that there's families that previously didn't have as much socioeconomic needs be placed in position of high need over this past year. So this is particularly important to think about given the current climate.
You're so right. And I think this is such an important topic that, we could really schedule another panel discussion and just deal with this one issue. But I appreciate Dr. Walls for her insight on that. So on pages 14 and 15 of the report, I designed an ecosystem map that shows all of the programs and providers for birth to 5. There's this clear dividing line between birth to 3 and 3 to 5. And that's because the primary program for newborns, infants, and toddlers is the CDSA. And then for preschoolers, it's the school system's programs for exceptional children. If we could come back to Lisa Cloninger, could you share with us how the CDSA is collaborating with Smart Start to make the transition between these two programs better for everyone?
Sure. And I definitely want to start this conversation by a big shout out to Cheryl and CMS. This all really started by lots of us sitting around the Zoom table during 2020 and going, what can we do? And how can we help families? And how do we mind the gap that we have right now? One of the huge gaps that happened, and Cheryl was responding to this just like we all were, is that the pipeline for families transitioning from our program at age 3 to exceptional children's program at for 3 to 5 just stopped because families couldn't get eligibility determination, families couldn't get IEPs written, and that has started up again, and they are working so hard to catch up and make that happen for families. So we've all been having these conversations about how do we make this work better. And we've always had that obligation as a program to have a nice handoff and a warm handoff to 3 to 5 services. And so I think we do that really well here in Mecklenburg County. So I want to say that off the bat. But we struggle. And so one of the things that's happening now that we're really excited about is that we have this opportunity to collaborate between CDSA and Smart Start to expand the GPS services or guiding parents to services and to extend that model to transition because we do have families that need more support than we can provide. And we have families that age out and leave our program. We talk about 3-year-olds being old, but they're not old, they're babies. And they turn 3 and they leave us, whether we're able to hand them off with a nice plan for their education for 3 to 5 or not. And so GPS is going to be able to help us support families through that gap that we're experiencing even more right now than normal because of COVID. So we have been planning for that for a few months. We're ready to think about that as the fiscal year starts in July. We're really excited to have Amy DeShazo's help. We're excited to think through that with Cheryl some more about how do we help each other on both sides of that equation, and how does Smart Start help us stand in the gap to help families who not only aren't there yet to their services at 3, but also families who may need more than typical amounts of support that we're able to provide for them. So sometimes families get lost in the process, whether it's something as simple as how to get their birth certificate or how to get proof of where they live. I mean, these are things that will stall families sometimes, and also need support around how do I prepare for that IEP meeting? What are the things that I'm eligible to have? What do I think my family needs? And thinking through that process. And so if the family has already left us, we have limited ability to support them after their birthday to prepare for that process. And that's how it should work. And so it's really great that we will have this opportunity to collaborate now as CMS continues to catch up from having, a time during COVID where they weren't able to provide evaluations and move children on to the next step that they need. So we're really excited about this, and I think it's going to help all of us continue to serve families better across the programs.
Well, thank you, Lisa, and good luck with that. And please keep us posted as things progress, and let us know about your successes. So this last question is for Cheryl. The next step for Smart Start in terms of taming this octopus is to begin the process of implementing the recommendations in the report. So what do you think is the best way for Smart Start to team up with the school system to affect positive change within the special ed program?
So when I think about teaming and everything that has been said today and everything that we've read in Taming the Octopus, it all comes back to communication and collaboration. When I think about all the different environments where our 3 to 5-year-old children learn, home, child development centers, 4-year-old programs within the school system, all of those environments need a strong core. They need a strong foundation that prepares each of those environments to meet the children in the family where they're at and to support them as they grow and they move on to 5. And the only way that we can do that is to come together to communicate about what does that look like? What does that look like for each of those environments? And then to collaborate around how do we support each of those environments, each of those programs, those providers, and making sure that they are ready to meet the needs of all of our children that are coming in their doors. So it really comes back to those 2 words that have been said over and over in this discussion is communication and collaboration.
Mm-hmm. Absolutely. Well, thank you, Cheryl. Thanks to all our panelists. And, with that, I'd like to turn things back over to Mike.
Thanks so much, Jonathan. And thank you to all of our panelists. That was a really, really good discussion. So we appreciate all of our participation. We're grateful for your willingness to support us, your knowledge and your expertise, and just the leadership you've provided today. We're going really well on time, so hopefully we'll have a little bit more time for discussion before we close out. One of the things we said early on and that Jake echoed this morning is that we don't want this report to become something that just sits on a shelf. We want it to drive change. I'm really happy to say that change is already happening. And I'd like to turn it over to Smart Start's Chief Strategy Officer, Jennifer Stamp, to talk more about the next steps going forward.
Hi, good morning. It's good to see everybody. So I'm really excited to talk about the next steps in this work. So we have next slide, please, Alex. So what is next? We'll go to the next slide again. Thank you. So what we've heard today is a lot of discussion around collaboration and communication, which are really, really strong recommendations that we can move forward with really, really quickly, I believe. And from the report, we have 6 recommendations already. That is, to me, is like a jumping off point, and so is today. But I would like to highlight a couple of recommendations that we are moving forward with right now. Next slide. And so Lisa already mentioned our partnership with CDSA, and so we are really excited to announce this. Our board just approved funding for Guiding Parents to Services, which is our premier program that serves children and families who the child has just been diagnosed with autism or they believe the child may have autism. We're expanding those services to children with all special health care needs. And the primary purpose is for Amy, who's in the role as the autism coordinator right now. We'll have to change her title, is to give a really, really warm handoff for families from CDSA into CMS and to provide that bridge and that support. And we've heard that from the report. We've heard that today. So we're really excited to announce that. And that's going to be happening within the next few months. And we also are committed to creating a central directory of services and supports for families. I know that came out of the report as well. And I've heard the panel talk about communication and collaboration, and maybe this might be a forum or for communication about services. And we want to get more input about how this will look and how we will use it. I think we are still in the planning phases of this, but as an organization, we are very committed to making that happen through funding and through convening. Next slide, please. So we talk about what's next, And I'm really excited to talk about what we're calling our early childhood solutions groups. And really it's a mechanism for us to use to bring collaboration, to bring conversations in the community around an issue affecting children and their families. And, right now we're talking about children with special healthcare needs. And Smart Start, we are a convener. We cannot do this alone. We all have to do this in partnership. So we would love for you to join us and participate in our group. And it's new, and we're going to learn as we go. But we really, really want to listen. We want to learn from each other, partner, and then eventually implement some recommendations. But I feel like this is part of the theme we've been hearing from the beginning of our conversation today around collaboration and communication. And Smart Start, we really want to be the mechanism to make that happen. So I think we're going to go to questions and answers right now.
Yeah.
Yep.
We're doing really well on time. We have plenty of time left. So want to make sure we give our guests a chance to ask questions or have a discussion. So we'll move into that phase. Thank you, Jennifer, for all of that. Let's remember that this is a solution-centered discussion, so we'll try to frame questions accordingly, and we'll try to get to as many people as possible, but bear with us. It's a little bit more difficult in an online platform. If you have a question for our moderator, for our panelists, or for any of our Smart Start staff, we'll invite you to raise your hand in the Zoom function. So you can do that by clicking on the participant tab, and there's a way to raise hand there, or using the reaction function. So if there's a question you want to ask, go ahead and raise your hand. I'll try to do my best to get to everyone, and when I call on you, you can unmute, let us know who your question is for, and just ask your question. So,
Mike, I'm sorry, this is Jennifer. Can we go back? I'm sorry, I completely forgot to remind all of you that we're going to be sending out a survey after today where you can indicate if you would like to work with us on one of the solution groups. So I just want to mention that, or email me directly. Sorry.
Can't get my hand in there.
All right. Do we have any questions from the group?
Okay.
Any hands raised yet?
Okay.
I have my hand raised.
Okay. Go for it.
Okay. My name's Sherry Kornfeld. I am a speech pathologist. Our company, Early Bird Developmental Services, is a private practice in the community providing PT, OT, and speech for kids birth to 21. And we work through the CDSA. We work with helping kids transition to CMS. And I feel like we've missed a little a piece of what's happening in the community today. What we haven't really spoken about are the children with special healthcare needs whose needs are mild such that they don't qualify for the CMS services or don't qualify for CDSA services. Sometimes they can access services through their insurance or through Medicaid, but there are a giant set of children who up until spring of 2020 we were able to refer them to the Polywog program through Smart Start, where they were able to get support and funding for specialized therapies. Back that spring, they had changed the program. So now only those kids who need behavioral support can access the specialized therapies through the Polywog program. And I just haven't seen any new programs or new initiatives to address these families who are desperately in need of services, whose kids who are having to make decisions about their children's care based on their budget. Maybe they get 20 visits of speech or 30 visits of speech and OT and PT combined. And so they have to, dole these things out. And it's just a huge need in the community. We worked through the Polywog program, and it was, we still do, but we have only a handful of kids now getting services. And I just wanted to highlight that need and bring it back to us, because we're talking today about some systems where there already is support. Like the CDSA does an amazing job of helping to transition. The CMS does an amazing job, but where do these kiddos who don't qualify for those programs, how do we capture that population? Thank you. Sorry for the rant.
No, thank you for that, Sherry. Anyone on our panel or moderator have any feedback there?
Oh, this is something that we clearly identified in the report as a gap in services. I'm not sure we came up with any solutions, but we didn't shy away from the fact that change had occurred and that this is something that needs to be addressed.
Absolutely. Sorry to interrupt. I mean, I know, and you and I talked, Jonathan, so I know it's in there, but I just wanted to bring it back out as something as we're looking forward toward thinking about new initiatives and new ideas, that I just wanted to bring it back to the forefront. Sorry.
Sure. So I would invite Jennifer Stamp, or is Mark Eberhardt on the call? Perhaps there's something that you guys would want to add to that.
Hi, yes, I'll speak to that. Hi, Sherry. Thank you for your question. And I know we spoke about this last summer. I feel that we do need to have a larger conversation about this. Excuse me. And I feel as if this is a really big systems question that we could start addressing as a community. The funding piece hopefully will shift. Hopefully we'll get more than flat funded, but it involves coordination of services, funding, and we want to solve this, but we need to do this together. And hopefully we can get together and talk about how we can, because I know you and I talked about insurance, the coverage issues. It's not, there's not a standardization across payment for families. So I really would love to engage with you in more conversations around how to solve this.
I'm in. Thank you.
Yay!
We're creating next steps already. I saw another hand raised. Karita, if I'm saying that right.
Yes, good morning, everyone. This has been a great discussion. I do have a question, and I was listening to what Lisa was saying as far as the handoff when the children become, graduate out of the program. And if they already have services that are already identified, and when they go to school, is there any type of record that is kept so it can follow the child to a preschool or a kindergarten that they will be going to help the teacher and the administrative staff to assist the child, so they wouldn't have to start from ground zero? Is there anything of a record that follows the child?
Mm-hmm. That's a great question. And I think the answer is it depends. When a family transitions, we expect for them to, between our program and to Cheryl at CMS, the child in our program had an individualized family service plan. And as they transition over to school system services, they go into the process of developing an individualized education plan. And between those families, any person who was providing services to the family before, all of those folks have opportunities, with the parents' permission, of course, to share information about what's happened. And so oftentimes people like Sherry Kornfeld, who was talking a minute ago, who maybe was serving the family, would provide information about what she was doing and how she was providing services to the family. And we collected all of that information to share forward. If we know families are shifting to, say, maybe they transition and they don't need services from the school system, but they're going to Head Start or to preschool, we definitely try to collaborate with those folks as well and make those plans. We are required to make a plan with the family, a transition planning conference, and make a plan with them about who do you want us to share information with and how do we help you have a smooth leaving from us, because we want families to leave us knowing what's going to happen next and be connected if at all possible, to the services that they're going to get next. So that's a great question. And so we do that as much as possible. And, you know, sometimes that doesn't work out like we want it to, but that is definitely our plan. We have mechanisms to share with Head Start and preschools too. I think we need to do a better job in talking with private preschools, child development centers, and those kinds of folks, and helping all of us make sure that we're keeping them at the table in the conversation. So that's a great thing to bring up. Thank you for your question.
Does anyone else have a question for the panel?
Hi, this is Eleanor Tolliver. I don't know if you can see me, or I know somebody else is going. But I had a concern about a statement that the doctor made about training his residents on behavior and saying most of these children are autistic. And I'm wondering if the training involves distinguishing between a child that's autistic and a child who might be suffering from traumatic stress and trauma. Because, you know, sometimes it's hard to distinguish those two. And, you know, the professor said, you know, it goes back to training educators. And I think it goes back to training the doctors as well, you know, because sometimes it's very hard to distinguish. And I really see children who are being diagnosed as autistic when they're really not, you know. And so is something being done? We need to go back into funding for mental health for people on this level, so that when people come into the centers, they realize that this child is suffering from mental health and not autistic.
Yeah, I think that's a great question, and it's literature that we need to continue to educate and learn about. You know, I feel like there's an explosion in discussion and knowledge about adverse childhood experiences and kind of how those affect the brain in early development and social determinants of health. You know, those are so important that, you know, a lot of times traditionally hasn't been addressed fully in the medical field. So, you know, when we're doing a diagnosis or trying to evaluate a child, a lot of times it's, you know, how do they fit into criteria? And, you know, there's a lot of gray in medicine, and there's a lot more than just criteria. And so we need to learn more and take some of that into account and figure out how to address that. And, you know, addressing some of those issues takes time, and it takes effort to kind of go into some of those concerns. And, you know, we need more resources to be able to kind of evaluate those. And I think that the future of medicine is going to be more integrated with, you know, more social work support, where we can kind of go into some of these issues to help the families early on and provide resilience for the family and the children. And so definitely I take your point into full account and want to utilize that knowledge in terms of how we do our evaluations. And so I fully agree with you. And it's not as simple. Medicine is not as simple as certain criteria. It's the big picture, and that's what we want to do when we evaluate our children and try to help them.
Thanks, Dr. Grant. Appreciate that. Does anyone else have a question? I don't see any hands raised at the moment.
Mike, I actually had someone text me a question. Great. And it was asking about any unique data that we had uncovered in the research for the report. And, you know, sometimes when you're doing a research project, the thing that jumps out at you the most is not the data that you uncover, but the data that just does not, you know, exist. I could give you an example of that from a project that I'm doing now. But when I think back about, you know, over the course of the 9 months that it took us to research this project, it was just surprising to me that no one really had a number for children under age 5 with a special healthcare need. No one really had a percentage of children who have a special healthcare need. You know, so we can look at, you know, what is that percentage nationally? What is that percentage in North Carolina? And then we can try to take those two percentages and multiply it times the number of kids in our community under the age of 5 and kind of come up with a range. But it's a pretty big range. And so I guess the biggest thing that I was surprised by was that no one has really determined that number. Now, I realize that the definition of children with special health care needs is very broad. So it may not be possible to know that number because there are certainly kids who have special needs who aren't receiving any services. But I think if there's an opportunity for further research, it might be to try to engage a research firm that knows how to do this type of statistical research so that we can determine what is that population, and then from that we can derive what is the number of children who just aren't even being served but who do have a need.
Yeah, I agree. Thanks for that, Jonathan. Thank you. Have any other questions? Anybody else want to raise a hand? I'll ask a quick question. There's no harm in ending early, but I'll ask a quick question. We at Smart Start, one of our current projects, we're working on advertising and awareness for pre-K programs across the county. We know it's often a stumbling block for people to know what pre-K options are out there, which one do they fit in, and how they get into each program. And I know that's been mentioned in a different way in this discussion. You know, there are lots of support systems out there. There are lots of organizations and services, but parents and families don't often know how to reach those, or you know, how to get the help that they need. And I know building the system of referral is one of the recommendations here. But from the experts on our panel or anybody who's listening, does the work in the community, do you all see any common areas where people, you know, come against stumbling blocks or run into a wall to prevent them from receiving services? I got a couple hands raised. Rachel, you want to?
Just based off your question, a huge hurdle is knowing that the services are out there. In my personal experience, the way I found other services was not through the school system. It was not through doctors. It was actually through my peers who were going through similar things. And a lot of the pediatricians and developmental pediatricians that I've come across are not aware of the amount of services that are available. My daughter, Abigail, she was nonverbal until she was about 3.5. And she was in speech therapy since she was 18 months old. But I did not know that we could go through the CDSA for her needs. We used the CDSA for my son, my oldest, and he was referred from his pediatrician. But her pediatrician did not refer us to the CDSA for evaluations or testing or anything. And I feel like, you know, we waited about 6 months for her evaluation. And I feel like if, you know, the pediatrician would have suggested different avenues and channels for us to go through, then we would have gotten her diagnosis earlier, and we would have been able to get a jump on her care, as opposed to it, you know, now she's beyond the age where the CDSA can provide support, and then she doesn't qualify for a lot of the support through CMS because of where she is. But we would have been able to get services started a lot earlier had we known, or the pediatrician known, to go through the CDSA.
Great. Thank you for that. That's really helpful.
Yeah.
Lenny Latham, I saw a hand raised.
Yes, I wanted to kind of answer that, as well as also kind of tag onto that with my own question. I see that a lot with families we end up working with, or even just with people I know personally, for parents who have concerns, when they go to their pediatrician, a lot of times they're told, well, we'll just wait. And I guess my question is, for the doctors on the call, is what kind of education can be done for pediatricians to refer early, rather than encouraging families to just wait when they don't see a definite need. What I always tell families when I'm asked directly is, call the CDSA. They'll come out, they'll do evaluations, they'll talk to you about your concerns, and they'll help you realize where your child is developmentally, and also whether or not services are appropriate right now, or if it is a just wait situation. So I see that a lot of times with families where they already know that they have concerns, but then when they go to the pediatrician and they're told to just wait, then again, it delays, like Rachel was just saying, it delays those services from potentially starting when they could. So that would be my question. I see that as a gap in services, or a gap or something that prohibits families from getting services sooner. And so again, the question would be, what can we do? This is something I work with the LICC, and we talk about this a lot, is how to educate the different pediatrician offices to refer early, and then let the CDSA kind of take it from there, because that's what they specialize in. So again, what can we as providers or other community organizations do to help families, or to, again, educate pediatricians or offices?
So I can try to answer that a little bit. I think that's a huge problem, and something that we are trying to be intentional about. I say we, as a person who does education and teaching for residents, and also for colleagues. So when I got to Charlotte about 3 years ago, I had to do a lot of the work on my own, and it was a little bit concerning to me that coming in new, I knew more about what was available in the community than my colleagues did, but because this was an interest and passion of mine, it took some time to do that. But I think there's a couple of things. One is partnering with your local clinics that you're working with is really important and really helpful. So some of the things that we've been able to do at our clinic is to have people come in and present at staff meetings and at provider meetings to share their services and to share what you have to offer. Just yesterday, for example, we did have somebody present at a staff meeting about MEC pre-K and who qualifies and what services are there and available for that. I think if you're able to identify at different clinical sites people who can serve as sort of champions for child development, then that's really great. Because they can be the ones who continuously remind people. So for example, during the pandemic, I was sending emails telling people, CDSA is still open, can still refer patients there. It looks a little bit different, but it doesn't mean we have to stop referring. And identifying champions is helpful, but also providing feedback. I think sometimes people in the community aren't necessarily empowered to give feedback to doctors or pediatricians, but I shouldn't speak for everybody, but I think feedback is helpful. So if there's a patient where you're like, this service could have been a really good benefit to this patient, to let the doctor know that, and so that they can learn, because it might just be something they had no awareness of. And I've had that happen to me. I didn't know for a while that GPS was a service available to patients. So I wasn't referring people there because I didn't know what it was. So I think having that communication, again, is really important, and knowing that we are trying to shift the conversation from kind of watch and wait to early intervention on the medical side.
Thank you, Dr. Wallace. That was very helpful. Appreciate that. Dr. Story, I saw your hand raised. Anything to add that, or a new topic?
Yeah, I was just going to respond to your general question as well as what Rachel and Lenny were sharing. So I've worked in a number of states, and I can also share that based on parent feedback and individuals I've worked with, that 3 of these main barriers, when you do even get to services and supports, tend to be financial barriers, child support barriers, and transportation barriers. So even if you get to that point where you are lucky enough to have, a contact person, have your liaison, have those supports in place to get the services for your child or children, those are some huge barriers that get in the way of that. So if you have multiple children, what are your childcare options? If you do not have a car, or there's not reliable public transportation, so of course, CMS, we can, it is a little bit better, but there are lots of rural counties and people that it's going to take a lot longer to get to those supports and services. So making sure those options are available. And then of course, financial, which we hit on earlier, and thinking about insurance and those options. The other thing I was just going to add that definitely came up a lot when I was working in Oregon, and I hear it coming up in this conversation as well too, is even once our medical doctors or, our intervention or whoever is giving a diagnosis. We have all mentioned too that we do lack a lot of those supports. So like Dr. Durant was saying, with those ABA services, we tend to be able to diagnose autism early on. However, that we know that there's often a 6-month wait period, and then thinking about like how helpful is it to provide that diagnosis if we can't provide some of those supports and services to help these families, especially with something so new and so big and life-changing. Is it helpful to give that diagnosis sometimes if we can't provide the additional follow-up for 6 months to a year?
Thank you for that. That was great. I appreciate that. Sherry, I think you have your hand raised.
Yeah, just to your question, one of the things that we find that happens a lot in the community is that we have maybe those kids that Dr. Story is saying have been diagnosed. They may be, in a daycare or preschool program, and the teachers just don't know how to deal with them. We can come in and do some, we're pushing into the classroom and doing our therapies, but a lot of our families end up without a place for their quirky kids. They're told they can stay, but they have to have a shortened day, or they'll have to pay for a shadow. And we're just finding that, sometimes there aren't the right places for some of our kids. And partly sometimes that comes from the parents wanting their kids to be in an inclusive setting. Something kind of to CMS, it doesn't seem like they're, besides like the MEC pre-K and some of those other programs, the EC preschool settings, they may not have any typically developing peers to model after. So those are things that I think about in the community with the families that we deal with a lot. And I just want to say thank you. This is an amazing talk.
Thank you. Thank you for that feedback. It's helpful. The last hand I see is from Kristen.
Hi, everyone. I'm Kristen Monteith, and I guess I'll speak to you from my branch family partner for special healthcare needs. I'm a branch family partner with the state. And just yesterday, I was on a call about learning about the LICC, which I knew a great deal about. That got me wondering what is going on with the LICC in Mecklenburg County, and does the community know how to access LICC information? And so is it active and where we want it to be in our county? And do parents know? Are parents participating? I think that group can really help with the collaboration and the communication, but we just need to fuel it. Historically, I have a degree in early intervention, and I worked at the CDSA, and I remember the LICC being extremely active. I am an early childhood instructor at the community college, and from time to time, I'd be going back to the LICC. I'm also a parent of a child with special health care needs, and so I've experienced that way. I lead the local hearing support group for families that have children with hearing loss. I'm involved in EDI, which is early hearing detection and intervention. And so there's so many things that need to be shared, and I may know a lot of them, a lot about, or a little about a lot of things, but I feel that we're just doing a disservice to our community without really paying attention to a group like LICC. That's all.
Great. Thank you for that, Kristen. Is there anyone that wants to speak to LICC? If not, we'll add that to our follow-up list. Jennifer?
Yeah, sure. The LICC does meet in Mecklenburg County, and Smart Start recently has taken on a role to ensure more support. It's a group of volunteers, and I believe that for a long time, Smart Start provided the backbone, and then CMS provided the backbone. And I feel as if we need to come in and do more. And to me, what I hear across all the questions is more coordination. And it keeps coming back to this coordination and communication. And I really appreciate that question, Kristen, and would love, for you to be involved and to help out. And
Sure.
yeah, I mean, because it's true. There are LICCs in other parts of the state that are more interactive, but I feel like our group we meet. There's a lot on our plate, and I really, from Smart Start's perspective, we would really like to support their work and support their connection to the community.
Thank you.
Mike, if I could chime in on that topic, this could be a good idea, bad idea, but I think it's one that's worth exploring. It seems to me as an outsider in this that LICC over the years, as well as Z5 over the years, participation has sort of been like a roller coaster with some years those groups being very active, and then maybe people get burned out and things kind of wane a little bit. And even though those groups have different missions, there's enough of an overlap there that I think it'd be worthwhile for the two groups to explore a merger, because one of the things that unites them in a common mission is child find activities. And a lot of what we're hearing today is that communication and collaboration is key, and whether it's getting the word out to pediatrician offices or finding parents who maybe don't meet certain eligibility requirements but still have a need for services. It just seems like there's an opportunity there for collaboration. So I'm interested in what anyone else on the call today, might think about this idea of, at least investigating the feasibility of a merger there.
I think that's, I don't know if anyone here wants to speak to that, but I think that's definitely something as a next step for us that we can follow up on and hopefully get some feedback on our survey. Sounds like a great next step. Thanks, Jonathan. I don't see any more hands raised, so here's Jennifer.
Yeah, sorry. Yeah, I just want to add, we would love to invite anyone on the call or anyone to come to LICC. They meet the second Wednesday of every month, and right now they're meeting virtually. And the staff who is convening and helping convene that group is our program director, Elizabeth Kabalka. And I can't put her email address in chat, but can I say it? I mean, is that okay? I mean, yeah, it's EKABALKA@smartstartofmec.org. Or just reach out to me and I can pass it on.
And we can make sure that gets in the survey as well or those of you that are interested, please indicate that in the survey. Well, seeing no other hands, I'll go ahead and start to wrap us up before we lose too many people. But again, I want to thank everyone involved today, from fellow Smart Start staff members to our moderator and panelists and all of our attendees. You have all made this a great discussion, a great event. We really appreciate your contributions and your participation. This is our first attempt at this type of discussion, and we're really excited about the response we received and the engagement. As Jake said earlier, just to the report and to this event, we had really good feedback, so we appreciate that and your encouragement. And we plan to have more of these discussions, so be on the lookout for more in the future. Everyone attending today will receive a follow-up email that will contain the full Taming the Octopus report if you haven't read it yet, as well as a survey link so you can tell us what you think about today's content. I would encourage everyone to participate in the survey, as it gives you a chance to ask follow-up questions if you didn't get them asked here. And we really, like I said, we want to continue this conversation. So your feedback is going to help inform us on next steps and what the next conversation needs to look like. If there's any other information you would like from a Smart Start perspective, please feel free to reach out to any of us staff that were on the call today at your convenience. You can also visit our website for more information about our programs and initiatives, learn more about the great work that our other community partners are doing, or to make a donation to help us continue the work we're doing in the community. Our website is smartstartofmech.org. So that is all we have for you today. Thank you so much for joining us, and I hope you all enjoy the rest of your day.